happen as a result of physical injury or maybe adverse drug reactions or maybe bacterial infections or viruses. So in terms of the viruses, we have about 5 viruses that can affect the liver. We have the hepatitis A, B, C, D, and E. But today we're just going to talk about the hepatitis
B.
Yeah.
Okay. But then would you say hepatitis B can also attack a baby, as in a baby that is in the womb? Would you say it can also affect pregnancy?
Well, a pregnant mother can have hepatitis B infection, but then the mode of transmission is through child delivery, through the exchange of blood. So when delivery is going on, the mother can pass the hepatitis B virus to the baby. Yeah.
So at that point, would it be stuck with the child till the child leaves the...
Yes, so in children like that, they have the chronic form of hepatitis B infection, because when they get it as early as that, the virus stays with them for a longer time, so they can have that.
Okay, you mentioned chronic form of hepatitis B. What exactly is the chronic form of hepatitis B?
So the chronic form is basically when you've been infected with the virus for more than 6 months. So that means it stayed in your system for more than 6 months. So that's the chronic hepatitis B viral infection.
Okay, and because when you say the chronic form of hepatitis B, it means there's another form of hepatitis B.
That's the acute.
Okay.
So the acute is when you are infected today. That's the acute viral infection that you have. But then when it stays in your system for more than 6 months, we classify it as chronic hepatitis B infection.
Okay, so would you say, let's say I have acute hepatitis B, would you say that one is more curable than the chronic one?
In terms of cure, hepatitis B doesn't have a cure.
Okay.
But then when you have the acute form, your body can fight off the infection. So when you get the virus entering your system, it goes into your liver. And then what it does, it has a DNA in the virus. So it can replicate itself by joining itself with the human DNA virus. So it can stay in your liver for a long time. That's why we say we have the chronic hepatitis B infection. So it can be dormant in your system when the viral load is that small. Like so low that you can't infect other people, but it doesn't mean it's gone. So when you do activities like you taking more alcohol, you do things that affect your immune system, the virus can replicate itself.
Oh, okay.
Yes.
Okay.
So it doesn't mean that sometimes when you do the test and you check and it's negative, it doesn't mean it's gone entirely. But when you have something affecting your immune system, the virus can replicate itself.
Okay. So as a person, what are the things that I'm going to, how can I tell that I'm getting hepatitis B? What are the symptoms that will show?
Well, the symptoms of hepatitis B can also indicate another form of condition. Because when I say jaundice, you having a yellowish skin or your eyes are yellowish, you are fatigued, more tired easily, you have muscle pain, joint pain. It can pinpoint to other conditions, but for us to say you have hepatitis B is when you've been tested and then it comes out to be positive, then we can relate the symptoms to the hepatitis B, making us see all this in an individual.
So in natural sense, even if I'm vomiting, I should go to a doctor to test it to see if I have hepatitis B. Yeah. Okay. And then what are the possible complications of hepatitis B?
Just as I said, it's the most common liver infection that we have. So the complications are liver cancer, liver failure, cancer, and it's the second leading cause of, cancer all over the world.
Okay.
And the primary cause of liver cancer all over the world. So when you have your liver being affected, there are other, your liver is a major organ in the body doing so many things. So when your liver goes down, other organs can equally be affected. Yes. Okay. So it's really just about that. Liver cancer, liver failure, liver cirrhosis, all those ones. And you can basically die because when your liver shuts down. Yes. So those are some of the complications associated with it.
And then how would you say hepatitis B is diagnosed by the doctors? What tests do they use for it?
So we do the hepatitis B surface antigen test.
Pardon?
Yeah. Hepatitis B surface antigen test.
Okay.
Yeah, so that's what we do.
Oh, okay.
So when we test and then it's positive, then you have the hepatitis B.
So is it different in other states? Ghana, the way we test over here, could it be different? It's the same everywhere else.
It's the same, yeah.
Okay. And then also, one thing I also want to know is that, is there an age range as to who can get the hepatitis B, or where is it common in? Which age range is it common?
everybody is at risk of getting hepatitis B. Just as I said, even newborns can get it when their mother have it, and then through delivery they pass it on to their baby. So everybody is at risk. But if you have multiple sexual partners, if you are doing drugs, you do tattooing, and then other equipments they use are not sterilized. I mean, if you have men having sex with men, if you have within the past 6 months you've had more than 2 sexual partners, you share your personal stuff with someone, and the person happens to be infected with the Hep B, you can get it. So those are some of the common risk factors associated with it. But then everybody in general is at risk of getting hepatitis B.
Okay, so let's say there's a hepatitis B patient. What are the things that he or she should do to reduce the hepatitis B in him or her?
You know, when we say reducing, you know, you are not supposed to do things to reduce your immune system, okay? So things like taking too much alcohol, I mean, taking this over-the-counter drugs like paracetamol and others, I mean, not eating well. Those are the things that will weaken your immune system, that will help the virus to replicate itself faster. So you just have to do this lifestyle activities. You eat well, you eat more fruits and vegetables, you avoid this pain medications. I mean, you do what your doctor tells you to do.
Okay.
You know, you don't have to stress the liver, because the virus entering the liver is stressing it already. So all the lifestyle activities will weigh it down the more, and they will speed up the, process of failing the liver. Yeah.
Talking about the fruits and the vegetables that we're supposed to be eating, which fruit and vegetable would you say is more advisable for hepatitis B patients to eat, or is not advisable at all?
Fruits have vitamins and all that, and they help build the immune system. The reason why we are saying eat fruits and vegetables is the vitamins in them that can help you boost your immune system. And when your immune system is strong, I mean, your major organs will definitely be strong.
Okay, interesting. And then I learned we have something like are there any, could the hepatitis B reduce one's lifespan? I
mean, when you're supposed to, let's say you're supposed to be 60 years, and then you start getting the virus around 50, probably if you don't control, manage it well, you can end your lifespan by 55 or maybe 53. So it depends. That's why we are advocating that we screen ourselves, because if you've not screened it, it is a silent illness that can stay in your system for a very long time. And before it starts to show symptoms, it might have affected your liver. So when you get to know your status as early as possible, then management can be done. And then that can increase your lifespan, sorry. There are people who are living with a chronic form of hepatitis B, and they grow, you know. So it's just about detecting it early and then coming to us and we managing you well.
Okay. So would you say it's safe for someone to marry a person that has hepatitis B?
Yes, it's safe. So let's say someone has hepatitis B and is been tested positive, the other doesn't have, you can take a vaccine to prevent it. You know, it's a common illness that can be preventable. That is why you would have to take the vaccine, and it's in 3 shots. So anytime you visit the facility, you take the first one, the second shot is a month after, and the third is 4 months after the second shot. So when you do that, you have a lifetime protection against the hepatitis B.
So what happens if I just go for 2 shots?
Well, you have to do the third one.
Okay.
Yes, you have to do the third one because it's 3. I mean, in US they have 2 that is taken 1 month apart, but we don't have that here. So you have to do the 3.
Okay. So then, are there any support groups or resources available for people with hepatitis B?
Okay, so when you go to any hospital, we have a public health unit that people come in for treatments like that. You know, when you are thinking of having a condition like this, you are concerned about your family members, you might give it to them if care is not taken and stuff like that. So when we see a client like that, we advise that the people closer to him or her will get the vaccine if they are not infected. Because if you are infected and you get the vaccine, it won't benefit you in any way. So we try to protect the people around you, and then we talk to you. You know, we try to, I mean, there's a risk of you getting depressed from all these things. So we talk to you. So when the groups there, I mean, when you come and meet your fellow human or a friend there, I mean, going through management like that, you can also equally talk to the person. So through that, they are able to encourage one another, and then, I mean, encourage them to take the drugs that will be given to them and stuff like that.
Okay, interesting. And then I heard you're doing a hepatitis B screening. Tell me more about that.
So the advocates we are doing right now, you know, since it can stay in your system for a very long time without you knowing. Some people chance on it when they are doing screening to be employed, screening to, travel, screening to get married. They get to know these things. So we are entering the communities and then screening people. Who knows? Maybe someone might be having the Hep B and he or she is not aware of it. And then, as I said, when you get to know it very early, there are so many things that can be done about it. So we are doing the screening on 13th August.
13th August.
At Presbyterian Church, Calvary Congregation at Choco, 7 a.m. So we are calling all and sundry to come and support us. Either you can come physically or you can send us something on our
I'll try to be there. I'll try to be there.
I'll be looking forward to it.
Okay, that's right. Now, that was Josephine Bimpong talking to us about hepatitis B. As you also heard, she's doing hepatitis B screening. That is 13th August. You can also go there. That is the Presbyterian Church, right? Yes, you can also go there and then also go for your screening. We'll be continuing the discussions next week on hepatitis B. In fact, there is a lot to talk about on this. However, this is where we wrap the show up. Before that, I want you to put your number on the screen for the viewers to call you.
Okay, so my number is 054-830-6592. And you can follow Josie's Health Corner on all social media platforms, Instagram, TikTok, and WhatsApp.
Right, as you heard, you can follow Josie's Health Corner on all their social media handles. Now, this is where we wrap up the show. That is the Stay Alive segment. You're still watching Healthy Morning right here on HSTV, and then we'll be coming to you with Infocons with James and Stephanie. Stay tuned. We'll be right back.